Hello, I'm Anthony Sanna,
I'm Dr. Michael Smith.
and this is Fusion Health Radio, the health, lifestyle, and mindset podcast. Episode 42, Insomnia, Aging, and Autoimmune Disease.
Welcome to Fusion Health Radio, your source for inspiration, information, and insight on what it really takes and what really matters on your journey to abundant health.
Hello, and welcome to Fusion Health Radio. This is the health, lifestyle, and mindset podcast starring myself, Anthony Sanna, and that other guy on the microphone.
Hello.
That's Dr. Michael Smith. Welcome. If this is your first time here, you're in for a treat. This is a discussion that Michael and I have behind the microphones once a week or so, talking about all kinds of things that relate to health as Michael sees them, in an attempt to help you live a better life, I would say.
That's the plan.
That's the plan, yeah. Michael, last episode we talked a little bit about chi, energy, something a little bit more, I think, obscure, if I can say so, compared to what we're talking about today.
Yeah, I think we got a bit obscure with that one, but kind of had to. But it's kind of literally a bit of a groundswell right now in the world of traditional Chinese medicine, where a lot of clinicians are, and I mean this tongue-in-cheek, kind of coming out of the closet saying, yeah, mea culpa, that whole energy myth thing that people ran with since the 70s, we just sort of, bought in, but it really doesn't make any rational sense, and there's way more credible ways to talk about this. And so we got into that just because that is a pretty big thing for people who are either offering Chinese medicine acupuncture as a service or trying to receive it. If you're caught up in an unnecessarily nervous belief system, I think it's a disservice to both practitioners and patients. Whereas if we can find a better way to translate these things and maybe, I don't know, risk the bigger picture view of, I don't know, life, physics, consciousness, whatever, and how that fits into health, but specifically with respect to Chinese medicine, I guess just fundamentally, it's just about bringing people a sense of real, rational, scientific confidence to something that has been, unfortunately, kind of snake oiled for the last 30, 40 years with respect to how the kind of PR has come out. So
It was a pretty deep conversation, I'd say.
yeah, that was the longest one we've ever done.
Yeah, well over, I think it was an hour and a half or so.
Almost two.
Almost two.
Almost two by the time we were done.
So if this is your first time here, the podcasts that we get into, sometimes they're shorter and sweet, sometimes they're a little bit more in-depth. Today's conversation around insomnia and that sort of thing might not be as long, but we don't usually script these things in any particular way.
No, that just makes us both sleepy.
This is about as organic as it gets.
Yeah, I don't know. I like improv.
Yeah, and it totally works. Before we get into things, just give people a quick reintroduction, or an introduction rather, as to who you are and what do you know.
So let's see. As a clinician, I've been focusing primarily on the integrative medicine model by mostly combining the vast wisdom and tradition and experience of Chinese medicine with the leading edge sciences of functional medicine and what we now call ancestral nutrition or evolutionary nutrition, evolutionary medicine, which is honestly it just gives me goosebumps when I think about how absolutely sensible that is, and how in 20 odd years of practicing medicine, how focusing in on that specific combination has made I don't know, it's made my life a lot easier as a clinician because I work with pretty complicated stuff. So it's nice to have something that's predictable and effective in that way. And it's super inspiring for patients who can look around and, be in a room where 80% of the people in that room are getting better with fixed name diseases. The Western medicine just has basically a counter of pills to take to just manage the symptoms. And I mean, those things do what they do in the short term, but again, for my real passion with this is just seeing people get better. And I mean, that's me as a doctor. Me as a patient, I have some autoimmune stuff, almost killed me about 25 years ago. So, I mean, every day for me is kind of like a free ride, got a free pass to come and try all this whole thing again and do it better. And, I follow the same protocols more or less, that I put my patients on, and I get to be as fit and healthy at almost 50 as anybody I know, and I'm supposed to literally be dead. So pretty happy.
Well, I'm glad you're here too.
Thanks.
I'm sure the people listening and watching are interested in having you share more of what you've learned along the way and things. As I know you, Michael, you're a researchaholic. You like to sort of dig into new ideas all the time.
And I guess it's worth saying, if I was to think of like bragging rights or something fancy to say, is I think technically I would accrue or deserve the title professor of medicine now, because I think I've been teaching medicine for over 20 years. So if I want to, throw down the big thump, I'm the professor.
Mic drop.
Mic drop. There you go.
Should we drop the mic? Yeah.
Please don't drop me on the head.
There you go. There's the mic drop sound effect. Wow, cool, great. And as far as I'm concerned, with regards to this podcast, I'm somebody who's followed Michael's advice to great benefit to myself. Over the years, I've had my own ideas around health and nutrition, and a lot of those ideas that I've discovered sort of pointed me towards to whatever it is Michael's talking about. Michael and I get along like a house on fire, and I actually have a soundboard and a couple of mics, and there you have a podcast.
Ta-da!
Ta-da! So you said something about disease just a moment ago, and as far as I guess our listeners concerned, diseases of affluence or North American standards, that sort of thing, cancer, diabetes, that sort of thing. But today we're talking about sleep. So is sleep a result of a disease, or is sort of not sleep, insomnia? Is that a disease as you would label it, or is that something totally different?
Well, I mean, if I was to get all, what's the word I'm looking for, semantical or something with words. I mean, the word disease means dis-ease, a lack of ease. So if you're not sleeping, your life is not easy. I know that's not all medical and technical. So much for the professor accolades.
Can we get a real doctor in here? Paging Dr. Smith.
So I guess in medical terminology, there is a distinction between what you would consider a disease as an active, progressive process that has kind of a fixed outcome, and then what we would call a constellation of symptoms, which we would usually refer to more as a syndrome. You could look at insomnia as a syndrome because it's part of a constellation of changes in the body where one of the loudest dashboard lights is I can't sleep. You can have perturbations in the structure of the brain and in where a lot of your neurotransmitters are basically manufactured. So in that sense, the insomnia would be like considered the disease because it's the one thing that's just, overtly causing the most trouble for that person. Although the underlying why is perhaps something more subtle. So I think if I was to try and guess maybe where you're kind of going with that, and not that you need to be going anywhere with that, but I think when we look at, health versus disease, we're looking at, I don't know, let's say an apple and then there's a bite out of it, and how rotten is the bite, or how big is it? Is there worms in it or whatever? And, the reason I bring that up is that we have the sort of subconscious awareness that happy apple, healthy person, apple with bites out of it, sick person. And I mean, that's pretty obvious, but when you look at something as fundamental to human health as insomnia or as proper sleep, proper diet, proper hydration, exercise, those things, a lack of any of those things for me would be like having a stool with a missing leg. So you could call it a disease, or you could call it a metabolic foundational instability in which all health is tilting towards a lack of that foundation.
Sure. Well, I guess my my approach in asking you that is just based on the assumption that I know from friends of mine who don't sleep, and they don't really see that as being something bad for them, or as something that's your analogy, I think, rings true for me. A dashboard light. They don't see that as being something as a result of something else. And so that's why I asked, is it something that is kind of a separate thing, or is it actually connected? And I mean, I guess I'm asking you a question. I have a an opinion about what that actually is. I just want to know what you want to know.
Yeah, I would say yes, yes, and yes. Yes, it's definitely something that has everything to do with illness and its progression. Although, like you're saying, it's so ubiquitous, or something that we all just have once in a while, that it's just, I had a good night's sleep, I had a bad night's sleep. It's different than saying, oh, I had a nice face, I had a boil in the middle of my forehead. It's a little more,
Right.
for something like that to
Right.
happen. So definitely yes to that. Yes to the idea that it's a part of a symptom complex, which also makes it easier to ignore, because other symptoms are probably more life-threatening or life-altering, at least at the beginning. And yes, number 3, to the fact that if you have chronic insomnia enough, it is going to basically be a drain. Instead of I don't know why I like the idea of a stool with legs as a metaphor, but instead of having 4 legs on the stool, now you have 3 legs and a hose draining whatever vitality is that's in the other 3 legs just under the ground. Because at a certain point, it's one of the most erosive conditions in terms of long-term health outcome. And that's kind of the first thing is we'll probably get into, is just sort of, random disease by disease, the consequences of insomnia.
Mm-hmm.
Because I think that just sets the stage for people to appreciate how interconnected the physiology of sleep and tissue repair, how the neurological processes involved work, whether or not you can still function as a glandular animal without sleep is pretty good to know, I think, for most people. I also want to get into a little bit about the sleep physiology, because once you get a sense of what can go wrong, then you want to kind of look at maybe what you can do to right the ship or correct some of those things. So you need to have kind of a map, if you will, and that's where I think having a basic sense of sleep physiology gives you the confidence to know what to do, why, and, knowing that what you're doing matters. Then there's this magical cultish hobby / obsession for a lot of people we call sleep hygiene, which is just a step-by-step group of practices you can put in place to ensure that on a kind of evolutionary level, you're maximizing your potential for depth and length of proper sleep.
Yep.
And then I'm going to just sort of maybe talk about some supplements and other approaches people have that, so far, at least in my clinical experience and my personal experience, I've had terribly unpredictable sleep since I was probably a teenager, so it's.
You have a lot to say about sleep.
I'm familiar with the ups and downs, if you will.
Sure, sure. Well, I think you already said it, but somewhere in there, are you going to actually talk about what sleep does?
Yep. Yeah, that's what I mean by sleep physiology. It just seemed more, I don't know, apropos for people to sort of start with all the little dashboard lights and what they mean, so that people can go, oh, time to take this seriously, if any of those things are tangential or they connect to your life in some way.
Sure. Well,
If they're not, it's just nice to know, to tell your friend who's got big baggy eyes, I just heard this podcast, and dude, don't drink any more caffeine.
not only are those guys good looking and funny.
There you go.
I was. What are you laughing
Now
at?
we're on video. I just got to roll with that.
I think it's important for me, anyways, to get a sort of refresher on what sleep actually is and what it actually does, because that sort of validates the idea of it actually being important, as opposed to something I just sort of take for granted. Mm-hmm. After going for a couple nights of not having a sleep or a crappy sleep or whatever it is, I can manage and do that sort of thing. But you and I both have a mutual friend here in town who, in the past 30 years, probably hasn't slept more than 10 of them. And that's because she's so wound up with stress and all different kinds of things. So, and I'm sure our listeners and our viewers probably have somebody in their own mind, maybe even themselves, as to who they're dealing with. So, or who we're talking about. And I think it would be good for them to sort of understand what that person could be like if they actually slept better.
Well, we could talk about the sleep physiology first and then get into the consequences. Up to you.
I guess I'll leave it up to you guys to sort of decide. I'm just sort of spitballing off the top of my head here. You tell me what makes sense to start.
Well, I think I want to go with the consequences, because that's, I don't know, it's like breadcrumbs that are actually made of big glaring neon signs.
Sure.
If you want to get something to lead you back into the purpose of how important this is, I think all the there's sort of like the carrot and the stick analogy. Mm-hmm. I think throwing a bunch of sticks in the air gets people's attention instead of hey, you want a carrot? Then most people are just like, give me that carrot, dude.
But there might be some carrot lovers out there, you never know.
You never know.
This is the internet. It's 2018.
So when you're getting into the consequences of sleep, the first thing you need to do is assess what we call the kind of volume of sleep interference. Just because it sounds fun to say things that roll off the tongue, like volume of sleep interference.
Now appearing 3 nights a week. Volume of sleep interference.
Yeah, your nemesis. Dun dun dun.
Yeah.
So that's based on sort of the symptoms of your particular insomnia. So people are either going to experience difficulty falling asleep, wakeful sleep, wake up at 3 a.m, or just fitful, or just super light, and you wake up every time your cat rolls over or something like that. And then there's people who, have mildly interrupted sleep, but don't really complain primarily about that. They complain primarily about waking up feeling like they just, work 3 extra days instead of got a night's sleep. So those are like, those 3 things make up a volume of how much your sleep patterns is interfering with your vitality and your just ability to be you. So if you're lying in bed for hours trying to get to sleep, that's a certain kind of PTSD almost. You're just lying there in the torment of shut up, or if I can just get my temperature of my pillow and my 1 foot out of the blanket and one hand in a cup of water. I don't know. There's a lot of just to get it right. So that's a really big thing. And when I've had that kind of sleep disturbance in my life, it's actually the apprehension of lying in bed and not sleeping that is the most difficult thing for most people with that pattern of sleep disturbance.
You're saying that people are nervous of not being able to sleep, and that causes them not to sleep.
Well, the technical term in psychiatry for everything, not just sleep, but everything, is called anxiety of recurrence of affect. Once you've had a bonky thing happen to you, the most pressing symptom in psychiatry is the fear it's going to come back.
Right.
Which usually brings it back because you're stressing out like a,
Yep.
monkey on cocaine or something. Going, ah! Anyway.
I think you could actually say you're stressing out like somebody who doesn't sleep. That's a pretty good analogy
Or
too.
that too, good enough. So then you take people who have wakeful sleep. So you wake up at 3 a.m. and, you're tossing and turning, usually with that kind of metabolic kind of insomnia. You wake up and you have the metabolism in terms of cortisol that you would around 9 o'clock in the morning. So you're up at 3, but you're like ready to go. Like, I could write a technical paper. Let's go, let's start the day. So it takes like on average an hour or 2 for people's biochemistry to sort of shift back towards sleep drive again. So that's another kind of hell with respect to the volume of disturbance, because lying in bed 2 hours in the middle of the night, tick, 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 when's my alarm going to go off? And then I have to run the whole day on crap sleep. So I'm going to lie there for those 2 hours, give or take, naturally obsessing about how crappy today's going to be.
Yeah, I call it advanced miserabilization.
Oh, we should put that in the next textbook.
Well, lying there, making oneself miserable about the fact that you're going to be miserable throughout the day because you don't have any sleep.
Yep. And then there's the third one, which is waking up feeling tired. So when we look at the statistics, and it's almost the same across the board, with respect to the harm to people. Have all 3, it's about a 300%.
Wow.
Right. So if you have 1, maybe it's a 30%, likelihood. Yet this could add to a likelihood for Alzheimer's dementia or something. But if you have all 3, you're now looking at, across the board of all conditions, insomnia can really impact. It's huge. So that's sort of the first thing for people who are listening who have insomnia, or for people who know someone who has insomnia. The first question, if your friends complaining about insomnia, ask them, well, is it more hard to get to sleep? Is it hard to stay asleep? Is it, you wake up feeling kind of bedraggled? And if they say yes, 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 then, or if you're the one answering and you're saying yes, 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 then it's time to step back and say, okay, no messing around here, because you're now literally advancing whatever likelihood for illness that you have as rapidly as you can with respect to your sleep patterns. I mean, it's a slippery slope, literally.
And so just to be clear, I mean, if somebody has a crappy sleep one night, that's not necessarily insomnia, is it?
No, but it's going to up-regulate what we call metabolic syndrome or insulin resistance and lack of sensitivity for about 2 or 3 days.
Right. And and on that as well, insomnia is somebody who consistently doesn't sleep well.
Insomnia is technically one of those three, or two of those three, or three of those three symptoms.
Right. Okay.
Right.
So you said that was the first thing?
So the first thing is just to appreciate that volume of disturbance, because I mean, it's, again, you're going from, no, if you have the Three Stooges, you have one of the Stooges, you have a 30% likelihood for whatever we're going to talk about to be serious. If you have all Three Stooges, it's 300%. I mean, that's not normal math. You don't go from 1 + 1 + 1 to 1 × 10. I mean,
That's a lot.
it's nothing. They actually call it asymptotic math, but I'd have to check. It's definitely exponential, though. So when you're looking at any of these kind of diseases we're going to look at, I'm going to just sort of touch on just sort of the underlying why. Some of them are going to be a bit of a geek out, so you might want to hold on to something, or
Might want to listen to this late at night when you're trying to sleep.
or just sort of put the kind of hum in your the back of your mind for stuff that doesn't really matter to you. So right now, the most terrifying thing that has to do with insomnia is cancer. And I really don't like using that word, because as soon as that goes into the airwaves, you've just given, I don't know, 25% of the people who heard me say that word cancer now think, oh my God, I've had poor sleep in the past, I probably am going to die, because we associate cancer with, inevitable death. And
Right.
I would encourage anyone to go back a few episodes to the one we call Rethinking Cancer and take a moment and go, oh, wait a minute, maybe I'm just like everybody else walking around with weird grumpy cells, and it's totally a fixable thing. Anyway, so people who have chronic insomnia, and this is going to be true for whatever number of examples we come up with, the biggest perturbation to health is that you're running on cortisol during the day, but way, way, way more to wake up, and then way, way more throughout the day to stay awake. People would call your second wind, right? Where you're, just got to get through that big project or whatever. And humans have an amazing ability to do that. Like, I've seen people, drag through stress for 15 years before they technically get too sick to keep going. Not that
Right.
I think that's the ideal outcome, but quickly, there's different pathways in your immune system, and there's no way we could get into that through audio. And even if I had the best PowerPoint, it would take days to try and make it make sense. But one of the kind of toggles or switches that go back and forth in general active immune system behavior is called the Th1, Th2, or Th3 pathway. So very quickly, Th1 is, that pathway is specific for intracellular infections, viral load, things that happen usually inside of cells, obviously like cancer. The Th2 is more of a rashy red irritation, reaction to something, maybe like a food sensitivity or hay fever or something like that. And I'm totally generalizing the heck out of this for any clinician who's going, but. Then we have the Th3, or what's called the Treg pathway, which is the optimal one because it keeps your body and your immune system kind of vacillating naturally between Th1, Th2. So as long as it can kind of like check in with all of them and keep them all running at a normal activity, your immune system would be considered a fairly effective police force or something. Now, if you're under high cortisol levels for a long period of time, what happens is your Th1 pathway gets basically diminished. So the immune system of the inside of your cells is now sluggish. And you would have to go through that whole podcast on cancer to get the intracellular kind of imagery of what's going on in there. So we have person without sleep. They have very, very deficient Th1 pathway. Intracellular immunity is sluggish. Their Th2 pathway is usually going to be aggravated, so they're prone to anxiety and rashes and all the weird things that stressed out people are. You can just tell them. Everyone's red and puffy and itchy and
Grumpy.
grumpy and whatever else.
And all the other dwarves.
Yeah. So that's going on. And then usually what happens, and this is one of the trickier things, especially with respect to cancer, is it's usually at the end of a big stressful cycle when you're finally getting your sleep back, or maybe you're finally taking some kind of medication, or the stressor is over, or you've retired from crappy job number, whatever. And then your cortisol levels start to drop, and then your Th1 pathways start to get active again. And all of a sudden, your immune system attacks all of the tissue processes that are going on in a malignant cell, which is complicated. But that makes the activation of the battle between the immune system and the malignant cells much more dynamic, often creating a bloom, a rapid spread of what's going on. So no, my advice is not to stay stressed out and never go to sleep because, oh my God, that's a bad thing. It's to just recognize that your immune system is kind of like a pendulum, and if it gets stuck in one place, bad things can happen. And if it starts swinging without repairing that potential imbalance or damage, it's going to make some bad decisions. So yeah, right now it's 300%. If you have all three of those symptoms with respect to insomnia and the volume of disturbance, you should really, really, really be doing everything you can to keep very, very happy cells, happy livers, happy everything else, and really sort of maybe, I don't know, sort of drag you to the end of the podcast, but hang out until the end of, like, here's some of the supplement ideas, or just, run to your favorite holistic, integrative medicine, functional medicine person and just say, we need to dig into why. Because if we don't, it's tick, 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 something troublesome is going to happen.
Yeah, sure.
Then we look at, next thing is Alzheimer's. I mean, it's a literal fact that chronic insomnia will basically turn your brain from a grape into a raisin. It will actually shrivel over time.
The lack of, so how do I say that? If you sleep properly, your brain's healthier, more nourished.
Yeah, so we've done a few podcasts on the brain and neurology and stuff. So obviously there are people that really want to dig into your noggin. I think we have 5 episodes on the brain, but
right.
The easiest way to look at it would be a person under chronic stress because of stress and obviously insomnia and not getting deep enough sleep. That's going to create a change in your immune system. Not only are you going to be running on high cortisol, high insulin, because those two things work with chronic stress, you're also going to have chronic inflammation inside the microglial structure of your immune system in your brain. So we have these little, we call them airbags. They're like little immune system components inside the brain. And if your brain gets hit like a concussion, then the microglial cells swell up to protect your brain from sloshing around getting KO'd again or something like that. But that swelling and the inflammation inside the brain isn't meant to be a long-term thing. It's meant to be, oh, I got punched in the head. I better keep my brain puffed up for a little bit just to let things settle down. If that keeps going on for the long term, your brain actually will use up your neurotransmitters and other fatty acids and other things inside the brain to fight off the inflammation. Right, we all know fish oil is good for your brain, and it's a great anti-inflammatory. So, obvious image, your chronic insomnia, your memory's going to crap. You start taking fish oils, and maybe you feel a bit better. But the question is, do you recognize you're just throwing water onto the fire? I mean, it's a good idea, but until you're turning off the fire, you're just throwing fish oils into a situation where it's only getting to do part of the job it wants to do because it's being just burned off as an anti-inflammatory. So that over time will change the structure of your brain, like mechanically change it.
Well, it almost sounds like your brain, or one's brain would get tired.
It shrivels.
Yeah, well, that's what I mean. It just sort of runs out of gas and just sort of...
Yeah, I guess I just got to keep going back to the physical imagery of atrophy. Like it weighs 4.5 pounds. It weighs less than 4 pounds. Oh.
Where did all that stuff go?
Yeah. And what's really powerful and I think potent to know is within the space of 3 to 6 months, if you're on a neurological regenerative protocol and you're doing something about the why, it's going to grow back. And what's weird, and this screws with neuroanatomists all over the place, but all the memories that you lost come back as soon as you have the neurological tissue to access them.
Wow.
Yeah, that's been one of the funner things to just sort of dangle out there with people going, yeah, it's funny, you know, raisin, grape turns into a raisin has, you know, 30% of the memories of the grape. You repair the brain and now you have the memories of the grape. They're just, yeah, I guess the tongue-in-cheek joke is that I'm alluding to is for 50 odd years we've been trying to locate memory in the brain and we can't.
Yeah. That's just fascinating to think that you could reinflate your brain and your memory at the same time.
It's kind of like, I don't know, turning the data on your cell phone. Oh, all of a sudden I have access to everything again. Or actually, I'm not sure if that works because I suck at phones. So then there's autoimmune disease. So if you look at your immune system like a brain, or like the inside of a cell, in the sense that it has characteristics and then over time certain stressors can change it, chronic insomnia will fundamentally make your immune system very angry and kind of stupid.
I think of a lot of people that I know or have known in my life who are kind of angry all the time and stupid. Does that mean that they don't sleep?
I mean, we could have a medical discussion about how correlation and causation are the same thing, but I think we would have to take that on a case-by-case basis.
Yeah, sure. Sure.
So cardiovascular disease being one of the bigger ones. I mean, running on cortisol, running on high insulin, there's nothing really in the long term worse for your vascular tissue. I mean, it's like the highway that makes everything work. And right now it's on fire. And it's shrinking. So yeah, that's another one. You have all three of those symptoms. It's 300% probability that you're more likely to have an actual like near fatal cardiovascular incident or stroke because the entire system is that close to just breaking down.
Wow.
Fertility in the sense of making babies, both for men and women. Insomnia is one of the bigger factors. How insomnia changes the immune system to be more aggressive, especially for women, is a big part of infertility. Just because if you're trying to conceive and there's foreign genetic material attaching to the wall of your uterus and your immune system is a bit of a grumpy cop and likes to shoot at people, it's going to actually attack the fetus before it actually becomes properly implanted, and you're just going to end up miscarrying. And I've mentioned this on the show a couple of times, but that's sort of how I found myself passively end up doing a subspecialty in fertility medicine, because focusing in on autoimmune disease for over 20 years, we just started noticing people as they got better were suddenly getting pregnant. We're like, of course that makes sense. But then people are like knocking on the door saying, I hear you do fertility medicine. And I'm like, well, not exactly, but we'll fix the why. For men, you know, if you're not getting depth of sleep, your testosterone levels are going to plummet. Present statistics for most men over 30 is if you have chronic insomnia, your testosterone levels will be of someone 10 years older than you.
Wow.
Which means your virility is that of someone 10 years older than you. So maybe if you're 30, but if you're like 60, suddenly things are, I don't know, working around 70. Gulp.
Yeah, that's I'm sure hitting a lot of people.
Yeah, well,
that are listening. I mean,
sex does seem to like get people's attention.
Yeah, I mean, testosterone has more than just to do with your sexuality, of course.
Well, I mean, for both men and women, it has to do with your, I guess what we would call your voraciousness, or how hungry you are for sex, your libido. It also has to do with tissue repair, muscle growth. Certain parts of your brain are dependent on testosterone, more so for men, but still for women as well. So it's you don't want you don't want that happening. So I mean, I think the obvious kind of next things would be like depression, anxiety, social anxiety disorder, or more vigorous presentation of PTSD and stuff like that. Again, primarily because of the inflammation and the atrophy. One that a lot of people don't connect really obviously is obesity.
Really?
Yeah.
So does that mean I sleep really well? Because I'm as light as I am? Is the opposite true?
Well, this is where correlation sort of comes in and says, well, maybe if that's a part of your symptom complex.
You're
but-
listening to the Correlation Podcast, starring Anthony. So, okay, obesity. Get back to the point before I take you further afield.
The fundamental thing about insomnia is that you're telling every deep, visceral, instinctual part of your dashboard light that you're one troubled primate. It may be infection. It may be you've been kicked out of your pack. It may be, whatever. But you're on a deep instinctual, physiological level, your body is trying to survive.
Mhm.
So when the body hits a certain amount of survival instinct, again, you're running on cortisol, which elevates insulin. Insulin basically, well, cortisol frees up blood sugar out of your muscles. It's called a glucocorticoid, which means something that it's a hormone that releases glucose. So once that glucose is released, that insulin goes up. So if you wake up every day on high cortisol, it's like you ate 3 bowls of breakfast cereal without breakfast cereal, because your body's just ripping tissue apart to produce blood sugar because you're panicking on a chemical level, right?
Mhm.
And having that much insulin in your blood changes the way your body deals with chemical energy, predisposing your body to try and force that blood sugar into triglycerides, into fat. So if every day, all day, you're running on cortisol, and every night, all night, you're tossing and turning because you're not sleeping, you're hitting that trigger, plus the deeper instinctual visceral survival trigger, which is, if I'm going to eat, I better store every calorie I don't need just in case, because I'm obviously a terrified, sick animal in a jungle that's got ninjas or somebody bad in there because it's messing with me a bit.
On the idea of obesity, an idea sort of floated across my mind. Snoring and people who are obese. What's the question I'm trying to ask? It's more about snoring. Is snoring something that actually interrupts sleep enough? Because I know a few people who are overweight who snore like thunder, bad. But they sleep all night and they get up in the morning and they do their thing, and then they rinse and repeat. They're not bothered by other things during the day, but I'm just wondering if snoring is actually something that's...
I think most people adapt to snoring.
Okay.
Well, the people snoring adapt to snoring, and the person in the room with them is probably, I don't know,
That's a different
shooting
kind
the sheep that they're counting at the fence.
That's a different form of sleep deprivation.
Yeah. But when it starts to move towards sleep apnea, especially with obese people, then for a similar mechanical reason that causes snoring, now you're actually dealing with, potentially fatal sleep apnea. So,
And I guess is snoring something that is that disruptive to sleep?
like I said, a lot of people adapt to just general snoring, but with sleep apnea, you stop breathing and, you
That's
wake
bad.
up basically blue-lipped and bug-eyed and, oh my God, I'm going to die. And
Yeah.
then I think the expression is rinse repeat, because they just roll over and hope it doesn't happen again.
Yeah. It's the blue lips and the blue ribs from somebody elbowing them all.
Right.
Telling them to shut up.
We should make cartoons. And the last thing I'd bring up, just to kind of complete the picture, and also because it's not very obvious, one of the most common medical outcomes of chronic insomnia that is crucial or critical for a lot of people is car accidents and falling downstairs and
Oh, yeah.
walking down the elevator shaft without noticing there's no elevator in it, or
And not surviving like a Buster Keaton movie.
some 70-year-old lady just fell down an elevator shaft in Manhattan or something because she didn't look and she was on her phone and she went,
Wow.
yeah. So I'm not blaming elderly people or phones. I'm just saying, if you're not sleeping well, you are the person who's going to do the funny stumbling thing.
Yeah. Wow. Yeah, I would never have put that on the list, but I guess it totally makes sense.
Yeah, it's huge
Hmm.
with respect to the underlying cause of many, many accidents and obviously many fatalities. So
So, that one, mean, when you talk about causes and that sort of thing, it just makes me think that if you're not getting any sleep and you're nodding off while you're driving, you should just have a nap before you do whatever it is. But I mean, that just makes me think that napping is probably not necessarily a deep restorative kind of cure, is it?
I would say it's a very good idea, but only for 20 minutes, ideally around 3 o'clock in the afternoon.
And that's because of whatever's going on inside the body?
Well, when we get into sleep physiology, which we're about ready to dive into, one thing that's very important to recognize is the balance and imbalance between what's called sleep drive and waking drive.
Okay.
So, because I'm into Chinese medicine, the first thing that pops into mind is that little yin-yang diagram with the black and white fishes and the circles and the dots. And so what's interesting about the physiology of this is that there's actually, like, you could call it like a mood, a metabolic trajectory or momentum that's moving you like forcefully 24 hours a day in the direction of sleep. It has, maybe an 8-hour window where it's likely going to win, but it's like all day, every day, your entire life going, okay, here we go. I'm going to try again. We're going to get all the chemistry together. We're going to do all this stuff and try and make sure we have the depth of sleep we need.
Okay.
At the very same time, 24 hours a day, there's a part of you going, okay, got to get ready because I got to wake up and be productive and not crash my car and, get my ancestral autoimmune diet recipes figured out or whatever. So it's first to appreciate that you have these two dynamic systems, and although they kind of seem antithetical or against each other, they're not really so much against as they are kind of like a pendulum or a pump. Like, as long as you get really good sleep drive that pushes you deep into sleep, then that reflexively forces your waking drive to say, oh yeah, well, I'll do some push-ups and come right back at you with the same amount of metabolic force or momentum. And as long as that pendulum's swinging really, really well, and you're going deep into sleep and you're having really consistent multiple hour days of focus and, humor and appreciation, then it's working.
Mm-hmm.
What happens for a lot of people, especially with respect to more chronic insomnia, is we get really, like I had said, kind of paranoid about the sleepless night. So we want to, naturally try and, how can I add more to my sleep drive, in the sense of supplements or staying in bed longer and things like that, or sleeping in longer, just because we have that myth. Okay, I'm in bed now. I got the sleep I'm supposed to try and get. Maybe I'll just get a little bit more. And I don't know if you have time to get super into the crazy geek outside of this, but when you actually look at people with severe adrenal exhaustion, one symptom is they get the best sleep between 7 and 9 a.m. They toss and turn all night, but if they can stay in bed for that extra 2 hours, they can gradually keep going. Anyway, so we have these systems, sleep drive and waking drive, and they're really doing their best to cooperate and compete, kind of like, I don't know, brothers giving each other, I don't know, what's when you put somebody in a headlock and you rub their head with your knuckles.
It's a noogie.
Noogie, that's the word I was looking for.
And for those of you listening,
making sure that's not just a weird Canadian mountain expression.
Noogy is how I would spell it.
Okay.
Maybe GN.
Yeah, never know. So there's lots of ways to try and improve that. And, again, for sleep, most people's instinctual thing is to try and really ramp up their sleep drive. But unfortunately, what that means is now you're in bed maybe 10, 11 hours in a 24-hour cycle, tossing and turning fitfully, trying to get some amount of sleep. And that's not a bad idea. In fact, that's a really good start. It's just not always what's going to work. Because, you spend the rest of your day, I mean, not literally, but it would be kind of cute if you could, shuffling around traffic in your pajamas and your slippers going, no, it's okay, everybody. I'm just going to go to work and just do my 5 hours, and I'm going to say hi to some people, and I'm going to, curl up and just get back home and stay in my little napping place. And then you'll never get any good sleep doing that. You'll go crazy because you're not working on the yin and yang, or you're only going to have as good sleep as you have waking, and vice versa. And this is where it gets confusing, because, you wake up in the morning, you've had bad sleep, the first reflex with respect to getting your waking drive going is, well, let's try caffeine. And small amount, maybe something like matcha might be a good idea, because it's such a gradual release of caffeine. But the ones that slam you upside the head and then leave you, I don't know, worn and
Jangled.
something on the street corner 2 hours later. It was no idea what happened to you. That's just not a really good way to affect sleep drive, because it's the perturbation is too accelerated. It's too high, too low, too high, too low. The mistake some people make is they'll have a coffee or like at 9 and 11, and then 3 p.m. they're like, okay, I'm feeling tired. Maybe they'll have more coffee and some sugar and some crappy starchy stuff. Again, just propagating that whole imbalance between sleeping drive and waking drive, because you're messing it with it chemically in some ways that aren't in the long term really going to help you out. So that's sort of the first thing to just appreciate, that you're constantly going between these two systems, and in order to improve either of them, you have to really try and improve both.
Mm-hmm.
Right? So once you're effectively asleep, you're going to go through what are called the 5 stages of sleep. So the first 4 are basically like, I just imagine like going down, I don't know, maybe at an elevator, you drop down to this basement, and then this sub-basement, and then this really deep basement, and then now you're down there with the president and his friends, just in case of a nuclear war, in the real basement. All right, because we have to just keep, I watch too many action movies, sorry. It's a sequential drop, right? And that sequential drop is an instinctually driven thing, because for millions of years, as prey more than predators, we would naturally kind of like drift into sleep and then kind of like slow it down and go, hold on just a minute, look both ways before crossing the sleep. And then walk into the next stage of sleep, and then you get a little twitchy, a little fidgety, and then you start to like really kind of like go in and out of conscious wakefulness, and then your body pauses there and sort of then looks both ways across the street or the sleep and says, is it good to keep going? No alligators, no tigers. And then we can enter into the next stage of sleep. And those 4 stages happen, and then when you get into deep stage 4 sleep for 10, 20, 30 minutes, that's truly the most essential component of sleep, is that stage 3 to 4, when your brain is literally allowed to finally flush its toilet, which is the only time in a 24-hour period it gets to do that, is in that deep restorative sleep.
Right.
And then once you have that few minutes of restorative sleep, then you bounce up into what's called REM sleep, where your brain is doing all this really interesting work with neural pathways and what we call scissoring or forgetting, which is an interesting, a big function of sleep is forgetting all the crap you did that day that you didn't need to remember for the rest of your evolutionary life or instinctual potential, right? Having said that, sleep also lets you remember the stuff that you really do want to remember, like, how to not hit your neighbor's car the 3rd time you drive out of your driveway in the winter or something like that. Because then eventually, those reflexes have to be burned in, right? So then we hit that REM sleep where you're basically lying there paralyzed with your, eyes twitching. And then that relaxes out, and then you go back into stage 1. And then 2, 3, 4, and then REM, and then
the word I know for that is a sleep cycle.
Mm-hmm.
Okay, so if my sleep cycle, say, is so long, does that mean it's the same for everybody else? Do we all have the same sort of way in and out of those 5 different stages?
No, that's a really good question, though. So your kind of average is about 90 to 120 minutes,
and
to go through the whole thing.
So I asked that because if I nap during the day, it's 40 minutes. If it's longer than that, I feel like a bag of dirt.
Yeah, that's the difference between napping and sleeping.
Right.
If you actually allow yourself to go into actual sleep, you have now effectively told your body you have gone through one diurnal cycle. So you wake up with the assumption after a sleep, not a nap, even if it's 4 in the afternoon, that it's tomorrow.
Right. Yeah. Well, and if I do it for any less than 40 minutes, I don't really sleep, or I don't really get any kind of restful benefit from it.
Oh, then you're doing it wrong.
Maybe.
So if you are looking for some nap strategies, we could do a special episode, but ideally you're going to lie down horizontal on your back or side, but back preferably, with something over your eyes so that it's dark, and preferably something cool so that your temperature of your head can drop, because your body temperature has to drop about 2 degrees for you to actually be able to rest. Mm-hmm. And the objective of napping is not to sleep, it's to go into what's called a hypnagogic state, where you're just sort of daydreaming and twitching and but you would have to have like no music, no cell phone, no YouTube, no whatever, because you can't be engaged in anything and nap.
Right. Right.
So if we've got this idea that there's sleep drive, like yin and yang, it's got to come in there and balance those out. There's lots you can do to improve either one, and I'll get into some opportunities in a sec. Next thing to be aware of is you really want to make sure you're ensuring depth of all 5 stages of sleep. That can take some fiddling around, but at least if you're getting 1 or 2 or 3 cycles of deep sleep, your statistical medical outcomes are way, way, way better than if you're only getting 1 or actually none completely. And that's where, I don't know, things like serious, rapid advancing psychiatric things, post-concussive syndrome, a few other neurological inflammatory conditions, that's where the rubber really hits the road. Is at a certain point you do not get into stage 4 sleep, and then your brain is basically septic. It just sits there trying to do what's called lymphatic cleansing, or the brain kind of flushes its toilet into the peripheral lymphatic tissue around the brain. Imagine not being able to use the toilet for 4 or 5 days. It's gonna be messy.
Mm-hmm. That's where the word shithead comes from, I suppose, right?
We're not allowed to use the big words on the podcast, as far as I know.
That's just one.
One, yeah.
If the president can use it.
Yeah, right. Oh, God. Oh, no.
Ooh, okay.
So
Let's just
there's
get back on
other
track.
therapeutic things like craniosacral therapy. Yeah, lots of, I don't know, acupuncture or other things that can really just help reestablish that proper stage 4 sleep lymphatic cleansing. And I mean, that's literally so essential that, there should be posters everywhere. So one thing that gets tricky for people when they realize that they may not be getting deep restorative sleep consistently enough, and they want to improve their sleep, the first thing you need to do is basically recognize that people have chronotypes, or sort of where we different people are different, have a different sleep style, right? I mean, for a lot of my life, I went to bed at 12:30, 1 o'clock in the morning. I would get up at 6:30 in the morning every day, and did that for, God, a couple of decades,
Mm-hmm.
just in the sense of athletics and training and teaching and wanting to have, a little time to myself in the evenings. So I'm familiar with, that kind of what we would call kind of a brief cycle and stuff. And that's what people would typically call your night owl, right? Somebody who would prefer to stay up late and then sleep in if they can.
Sure.
Some night owls will stay up late just because they wanna, and they'll get up early because they gotta.
Right.
Right. Then there's people we call early birds, which are people who go to bed early and love to get up at the crack of dawn and get out there and start, making hay or whatever they want to do. And depending on work cycles or other things, sometimes it's a bit tricky to move your chronotype around. And typically you would do that about 15 minutes per week. So if I typically go to bed at 1 a.m. and realize that given my, I don't know, medical diagnoses and what I apparently need for sleep and need for depth of sleep, I'm suddenly made aware, oh my God, I better move this around. Again, it's about 15 minutes every 4 to 7 days. So if I usually go to bed at 1, for a week it's 12:45, then 12:30, then until you get to like 10 p.m. And 10 p.m. is the optimal time to go to sleep. There's an old saying, not sure where it comes from, but it goes, for every hour of sleep you get before midnight is worth 2 afterwards. So by getting to sleep by 10:30, that first sleep cycle, if you really get into it, is going to really set you up for a much better cascade of cycles.
Yeah, I've heard that, but I've often thought it was just like a, I don't know, old wives' tale or something like that.
Maybe, but it's also pretty medically accurate. I think you're allowed to have both.
Okay. Thanks, old wife.
Yeah, there you go.
Wife.
Yeah, so changing it can be tricky, but for some people that actually really does make a huge difference. As people age, sleep physiology changes. You might go from 7 hours to like 4 or 5 in the sense of predictably getting and needing sleep,
Right.
being able to sleep. Obviously, people going through menopause because of changes in endocrine function and stress and things like that, sleep's going to be all over the place. People who are in the process of losing a lot of weight, that can really fiddle with your sleep in a pretty negative way at first. One thing a lot of people ask me about is, if I have trouble sleeping, when's the best time to exercise? The only way to know is to find out. Spend 2 or 3 weeks, working out at 7 a.m., then 2 or 3 weeks working out around 6:30, 7 p.m. And if that doesn't feel right, then the optimal time would be about 3:30, 4 p.m.
Is there, with regards to sleep or otherwise, is there like a bad time to actually work out? Just with,
That's why you have to do that experiment to find out where your exercise adaptation matches your sleep adaptation.
Right. For years, I worked 3 to 11. Years ago when I worked in the hotels and such, 3 to 11. And by the time I finished my shift, 11:30, hop on a bike, and I'd ride home, and I would just be raring to go by the time I got home. I would be so awake.
Yeah, I mean, and with, I remember being a bartender, we'd get off,
Yeah.
1 o'clock in the morning, whatever, and we're all wired for sound, and we had all the leftovers from the restaurant to pig out on. So,
Yep.
it would be what we would call over pours and leftovers.
The good life.
The good life. And then you'd stagger home at 3 o'clock in the morning going, ow.
Yeah. But those were the days where I could actually do that and then get up the next morning and still hop on a bike at 6:30 to be work at 7 o'clock, right?
That's the amazing thing about being young and all that.
Not us old guys.
No, not anymore.
Us old codgers. Yeah.
So a couple other quick things. A lot of people make the call it the misapprehension that alcohol is a really great sleep aid.
And so what is it about alcohol that actually makes people sleep? Or is it just sort of,
It's
make them unconscious?
It's basically, it's an inebriant. If you drink enough of it, you will just pass out. If you
Right.
drink more than enough of it, you will not wake up.
Yeah.
So definitely if you're using alcohol to diminish your ability to maintain rational capacity, the only benefit that's going to help you with going to sleep is you can't organize enough of an argument to maintain any kind of like linear track. Because a lot of people, when they're lying in bed tossing and turning, they're either in a very creative problem-solving mode in the sense of happy, I'm going to finally make my treehouse, or they're in a very process-orientated problem-solving mindset because they think they actually have to figure out tomorrow right now.
Mm-hmm.
We all do that. But it's just to say, you could be having fun in process mind, or you could be having, great apprehension because of deadlines, because of process thinking. But alcohol either way is going to muddle you up enough where you can't really maintain the process thinking. So you just kind of like get bored and pass out. And in fact, that's similar to some of how the more popular sleep drugs work. They're called sedative hypnotics, where they basically scrub your ability to concentrate every 5 seconds. So you're like, oh, if I could finally get that girl's phone number and then phone? Ooh, what was that? I think I heard, a creak in the basement or, something. And then, oh, wait, what was that? And, you feel like Homer Simpson or something, but you just keep going, what?
That's pretty funny.
It's pretty funny. But the problem with things like alcohol is that it interferes with your liver's ability to secrete glycogen. So at 3 o'clock in the morning, the likelihood you're going to wake up feeling hungover and awake and unaware that you're hungover and awake because you're still hungover is higher. And then when you do finally wake up, you're waking up hypoglycemic and grumpy and, it depends, I guess, on how much you would drink, but probably hungover and having not really slept, but feeling like, wow, for about 7 hours, I have no idea what happened.
Right.
Which is not necessarily asleep, but you have no idea what happens. And this is a quick, funny story, but because I've been dealing with insomnia for a long time, 2 or 3 times in my life, I've done the tap out thing and gone to the medical doctor of choice and said, dude, I could really use a sleeping pill. I'm just not sleeping at all. And sometimes that happens because of stress. And just as often in my life, it happens because I'm in a really big creative, or like I'm writing a book and I just can't not be happy thinking about what I want to write. So basically I take this stuff, and I had this experience. I don't know, I guess this does get a bit adult, but I'll change the outcome somehow. I was using a sleeping pill. It's called Zopiclone for sleep. and it's your classical sedative hypnotic. And I was at a friend's place, and um, we were having a glass of wine with dinner or whatever, which isn't that big of a deal. And then I had taken my little Zopiclone, and I meant to basically pass out on the couch because I was crashing at a friend's place, and woke up in a very different circumstance.
With your underwear on a lampshade in a strange bed, perhaps.
That's probably a fun way to put it. And on one other occasion, similar situation, different people, I woke up the next day and I had woken up somehow in the middle of the night and made an entire feast for 6 people, laid out on the table, sat down, apparently made myself a plate, had some food, and went to bed.
And no recollection of that in the morning?
Neither of those experiences I have any memory of at all. Apparently that's just one of the side effects of Zopiclone if you happen to have a glass of wine the same evening. So FYI for people out there, alcohol does not help you with sleep, and never mix them with the modern sleeping pills, because you may find yourself waking up in a situation that you have a complete blackout, zero memory from. And I have like that. I only have those 2 experiences in my entire life that were like that.
So you're saying there's more that you just don't remember?
No, I think if I had more nights of that's probably the only 2 times I've ever done that.
I'm just
Bad in my life.
trying to make you sweat here.
Yeah. But I'm just saying, like, it's a very, very weird thing to have other people say, I have this memory of this experience, and you to go,
Wow.
and them to go, but
Yeah.
Anyway, so there's lots of other different kind of medications and stuff like that, but when it comes to not only understanding the basic physiology of sleep, it is so important to try and focus on natural opportunities, because, like I said, sleep aids, even using regular melatonin, can be a little bit messy. I'll probably come back to that in a bit, but yeah, lots to it.
So we've been talking about, I guess, issues that come up from a lack of sleep, and is this the part where you want to get into the sleep hygiene, the sort of what you can do to sort of make sure you sleep good?
That seems to be a good idea.
Yeah, and sleep hygiene isn't necessarily a new term, is it? I mean, it's something that I remember reading with regards to, what did they used to call them? Turn of the century stuff, where it was like a health sanatorium or that sort of thing. People would actually go away to these health retreats, and they do everything from daily colonics or enemas to eating certain foods to exercise routines, all this sort of health things to sort of get people back on track. Is where I first heard of sleep hygiene, and because of that, I sort of discounted it as being sort of old-fashioned ideas that didn't really make sense. But that's not necessarily true, is it?
I would say there's some old-fashioned ideas that we're coming to recognize make sense in ways that we didn't really have a thing to really hook it on before.
Right.
We haven't really gotten into this part of sleep hygiene or sleep physiology, but I think it's worth bringing up. So light enters your eyes and then, passes signaling into the brain. And depending on volume of light, volume of different colors or amplitudes of light, your brain understands that it's a different time of day.
Sure.
Right. And that this is kind of a tricky thing, but it's super cool, I think, to, I don't know, in terms of fun facts you can share with your friends at a party. When you place a human on the planet and it's first thing in the morning, the sunlight is coming from basically sunrise. So when you look at the volume of the atmosphere that light has to basically travel through before it gets to your pupils, that's about as long as possible, right? And the amount of light or the colors of light that are coming through are the most abundant across the spectrum of light, because typically, statistically, at night weather is a lot calmer than during the day. So the atmosphere doesn't have a lot of dust or other stuff in it. on a clear night, you wake up in the morning and boom, you have the most massive volume and spectrum of light possible, which is an amazing thing to do. Like if one part of sleep hygiene is when you wake up, you just get up and go outside and you don't stare directly at the sun, but you definitely look in the direction of this sort of the brightest part of the sky to just for 20 minutes make sure that something is driving the sleep drive. And that actually goes through what's called your suprachiasmatic nucleus, which is this thing that basically tells the HPA axis, your pineal gland and stuff like that, that it's either time to wake up or time to sleep. So we have this master clock called the suprachiasmatic nucleus, or the SEN, and it's constantly in communication with, kind of the master regulating glands in the brain. So again, here we have, proto-human, first thing in the morning, diffuse but very, very broad spectrum of light, super healthy. Around noon, sun's right above us. Again, let's assume it's a clear day. Now the sunlight has to go through the minimum volume of actual atmosphere to get to your pupils, right?
Mm-hmm.
I hope that I don't know, the basic imagery of that fits for people. And for whatever reason, that measures in your eyes as the most blue light.
Right.
And I mean, I could try and get into the physics of that, but I think that would just distract people. But so the brightest midday light that tells you you're in the maximum of sleep, or the minimum of sleep drive and the maximum of waking drive, is driven by blue frequencies of light. And then as the sun hits towards sunset, now again, the sunlight's going through a pretty maximum volume of the atmosphere, but because of traffic and wind and weather and other stuff, statistically, it's likely to be, there's more called debris or interference in the atmosphere. So the amount of actual light that's getting to you is more the amber kind of red spectrum. So that's the essential kind of step one of sleep hygiene is, especially in the modern world, is you got to control the light coming into your brain.
Mm-hmm.
And if you can't do that, and nowadays it's hard because everyone rolls over and looks at their phone, and it's kind of weird, but why did Facebook choose that blue?
I have a whole bunch of BS reasons.
So I'm just saying that's the perfect, okay, get up and be nervous kind of blue, right?
Sure.
Anyway.
Well, I mean, I've seen that all the time, and here's my phone,
Mm-hmm.
right? And I don't know if you can see it in the screen here if you're watching, but my face should get a whole lot brighter. But
It's a little hard to tell with the big lights we've got here, but yeah,
but
I mean
that
that's
idea
the thing.
of the amount of light that emits from your phone, you don't think it's much during the day
Mm-hmm.
until you actually look at your phone when you wake up in the middle of the night and you turn your phone on to see what's
Yeah.
going, and all of a sudden your whole room lights up. That's how much light is actually burning into the back of your eyes.
Or you see these two little dots on the back of the wall behind your head, like, oh.
Exactly.
Yeah. So I'll come back to the light stuff in a little bit, but I just wanted to bring up that thing about waking drive is light.
Mm-hmm.
And again, I'll come back to that because I just want to cover obvious things. So when a person has poor sleep, the first thing that clinically we suggest people do is to try to have an extended sleep cycle. Very, very like almost military rigid extended sleep cycle. So you're going to say you're going to stay in bed for 9 hours, 10 o'clock at night, 7 o'clock in the morning. Your job is to stay in bed. Just be in bed, toss and turn. If you want to put on white noise, maybe that would be a good idea. Turns out, if you go on YouTube, you can find any number of 10-hour audio tracks of rain falling on a canvas roof or a
Tin
tin
roof,
roof.
or the
Which-
thunderstorm.
For whatever reason, rain is the most effective soporific white noise that's been medically researched and proven.
Mm-hmm.
So if you're looking for, I mean, I usually like thunder and wind and animals. There's rain in there too. I just like the storms, but
It's the same idea for some people who sleep with the fan on, right?
Yep.
Yeah.
yeah. So if you have that kind of white noise thing, that's going to help. But with sleep extension, you're basically, okay, I'm just stuck in bed to see if I can just get into the habit over usually the space of about 3 weeks of just getting bored enough to just like, okay, 9 hours every night, sitting here doing nothing.
And that also means not reading your phone or reading a book or anything like that, right?
This is sleep hygiene, not sleep hijinks.
Hijinks. Right.
Right. So you gotta follow all the rules, right? So
Right. And I just wanted to be clear on that, because for some people, I'm lying in bed, I'll do what I normally do, which is Sudoku or something, right?
Yeah. So yeah, when we get into the sleep chamber, we'll see how that may or may not be allowed. But just for common sense sake, if you are trying to do a step one, just get into the sleep chamber. We'll talk about in a sec.
Right.
But just force yourself to stay in bed 9-10 hours for 3 weeks.
And so the idea on that then is to how do I say, trick the body into, hey, this isn't such a bad thing after all.
There's more of the mind. I mean,
Okay.
I know for myself that as a person who's had insomnia, if I'm having a really hard time sleeping, I mean, it's literally like the hell of the whole thing is lying in bed knowing that tomorrow's going to be less.
Yeah.
Or worse or something.
Yeah.
So by habituating people to just getting comfortable or at least familiar with just being in bed and having nothing else to do, at a certain point, it's kind of like, you ground your kid for being bad. They just eventually stop being bad because it's boring.
Okay.
I will bore you into your health. But I mean, that's just step one, because usually that one gives people a chance to really get very intimate with all of the different tossings and turnings of the body and the mind, and maybe actually really start to recognize, I've got some serious thinking to do. I mean, I'm staying up at night thinking about my marriage, my kids, my job, my money, my taxes, whatever it is your thing is. And sometimes that extended sleep practice just suddenly gives you some perspective on the fact that, if you're a go person and you're only giving yourself 6 hours a night to maybe get barely enough sleep, given your, think about the guys in Japan who drink till 2 a.m. and then get up at 7 and pretend that they're fine.
Yeah.
So when you've given yourself that chance to reflect on you and reflect on maybe why you're tossing and turning, that's another really profound benefit of that sleep extension, which is, what's going on?
So this makes me think, does everybody need to sleep for the same amount of time? Like as much as you said, 6.5 hours in bed at midnight, up at 6:30, is that necessarily a bad thing?
No, if you've adapted to that and it's good for you, and there is actually a couple of genetic tests you can get that can tell you whether or not you're one of the lucky people who can basically thrive on 3 sleep cycles a night, right? Which is 5 hours of sleep.
Right.
Maybe 6, but for whatever reason, people with that gene work out really well. Some people do better with 2 sleep units. Like they sleep, they get up and read for a while, and they go back to bed. Other people are just mono sleepers. They go to sleep, they stay asleep, they wake up, and then they're done.
Okay.
So that there's different styles to it, and I'm glad you brought that up, because that's good for people to be aware of. That it is pretty. There's at least 3 or 4 different probable kinds of sleeper that you could be.
Yeah, but and you're talking about the quality of sleep when you're sleeping, as well as how you function during the day, and what sort of physiology presents itself based on how it is you sleep.
Yeah, and again, I'm just being really clear with the sleep extension. You're basically focusing on getting bored, getting to know you, getting to know what you're really worried about, and seeing if that simple thing of just restricting distraction allows you to just basically get into a healthier mode of sleep drive. Because if you have nothing else to do and you have eventually enough sleep drive, you will sleep more. Unless your waking drive is keeping you up because you're nervous about something, and 3 weeks of sitting there in a dark room, you're going to figure out what you're nervous about.
Right.
So the next thing we usually do therapeutically is obviously to restrict sleep. So now you're only allowed to be in bed from noon until 6 a.m. Like, that's it. You're not allowed in that bed any other time of day, no matter what.
Midnight till 6 a.m.
Yep.
Right.
Or 10 till 4, or whatever it would be. But sometimes in order to charge up your sleep drive, you actually have to restrict your sleep.
To make your body say, hey.
It's the only chance you're going to get, man.
Right.
Instead of, hey, you got nothing else to do like for hours, so what do you want to do?
Right.
Right. Same trajectory in the sense of metabolism, completely different process. Because after 3 weeks of only having 6 hours to be horizontal, your body will be like, okay, fine, then I'll just do what you make me do, because you're exhausting the wake drive in a way by giving it way more time to run around, and forcing sleep drive to kind of do enough push-ups to force its way to balance things out.
Interesting.
So that's just step 1 and 2 for everybody. If you're listening, or you know somebody who needs some kind of talking points, like what should I do? Where does this start? It starts there, but it also starts with what you would call the feng shui of where you actually sleep.
Sure.
And we call this your sacred sleep chamber, and it should be very dark, like blackout dark. I mean, I know people who actually take electrical tape and put it over the little lights on their alarm clock.
I'm that guy.
Just because I'm not going to lie there with this, red thing. I've got a space heater.
The thing I hate about traveling is going into a hotel and having that stupid microwave oven staring at me for the whole night.
That's why we unplug them.
Drives me nuts. And if they're plugged in behind a large
Oh, yeah.
armoire, it's like socks over the top,
Yeah.
or something. Over the little clock, or the clock beside the bed. That thing gets unplugged, put into the bathroom.
My laptop over there, because I had a guest over last night and we were listening to some music, and when we decided to go to sleep, we turned the laptop off, but it was still plugged into the wall. So it has this blue charging light that's like the absolutely worst possible blue color.
Were there airplanes circling overhead because it was like a runway light was so bright?
We very rapidly turned the computer around to make the blue light point in another direction, because we were both just laughing at the fact that whatever dumbass decided to design that computer put a big glaring blue light right on the part that points at your face while you're falling asleep. Anyway, so temperature is important. Blackout is important, like zero light. Some people get these little puffy, blindfold kind of eye covers.
And eye mask, sure. When you say blackout, you mean the whole room should be dark, right?
Absolutely.
Like,
no.
So I've got an eye mask, but there's a street light somewhere on my street that I want to take a pellet gun to, which makes my room, I could almost read in one part of the corner of my room. Should I be putting like a blackout curtain over top of that to make it dark?
Yeah, I'll just cover the mic here and say, I got you a little pellet gun there, my friend.
Okay, I'll take that as a yes.
Yeah. So anything like that.
Yeah.
So light's important, sound diminished as much as possible, and/or a white noise thing going on. It's so important to just make your sleep chamber about sleep. Sure, it's a bed, you can have sex on that bed, but that room is dedicated almost entirely to sleep.
Yeah.
So no screens, no distractions, no tablets. You got to keep your phone in another room. This is a Chinese medicine thing, but if you want to keep some fresh air moving through the house, it's ideal to keep a window open in a different room and leave the door partially open if you can, which makes the light control trickier. But it has been my experience that if you're in a really cool room and there's a cool humid breeze going across your skin, you can wake up basically with a kink in your neck or something like that. There's reasons why that happens, but
Well, a couple of ideas there. I think a lot of people sleep with their phone by their bed, and I've got friends who sleep with their phone beside them because it's their alarm clock.
right.
But they leave their phone on or in the ready state, which I can understand because none of my friends are brain surgeons. They're not emergency. They're not EMTs or anything like that. They're not firemen or firewomen.
Right.
It's not like they need to get up at a moment's notice to go respond to something, and yet they leave their phone on because they're afraid of, I don't know what, missing something. They're so brainwashed to that idea,
Yep.
which I get. The phone for me, airplane mode, and it's at the other end of the room. And if it's plugged in and it's the alarm clock, I just turn the alarm up because the phone has that little button on the side that allows me to do that, right? I usually wake up when I run out of sleep anyways. I wake up before my alarm, so I don't need to worry about that.
Yeah, the thing that, I guess you'd need to really figure out your phone, because there's like all the little subtle chimes and beeps and buzzes and vibrations and stuff.
It's like dead, off, quiet. Volume's off, no vibrate, nothing.
Yeah. So I'm just throwing that out there for the listeners, that if you are going to stubbornly keep your phone, in and around you, one, you're just having more Wi-Fi going through your brain, and two,
Yeah.
if it does make little noises and stuff, the whole anticipation of popularity contests or whatever else is hooked into your brain around beeping phones is going to exaggerate your insomnia.
Well, I think there's something to, for me, knowing that my phone's in airplane mode, or technically off, means I don't have to think about that. I don't have to sleep in anticipation of that next text or notification coming in, because I know that's not possible until I turn it on again.
Oh yeah.
So
I
there's
think I
that.
just figured out what airplane mode means.
Yeah. And for those of you watching, the room just got 40 watts brighter. Ding! There's a light bulb over Michael's head.
Yeah, I don't really get my phone. Working
But
on it.
the idea around that is to sort of shut off in my logical brain what I know is possible for my phone to do when it's on, right? So if that's no longer there, if my phone's actually a dumb phone, then it's no longer in its smart mode,
Right.
then I can sleep, because it's like, oh, well, I give up for 8 hours.
Yeah, well, that makes sense.
Yeah.
So, just going back to the Wi-Fi part, some people do better if they turn the Wi-Fi in their house off while they're asleep. I can't do that because I have a teenage kid who'd kill me if they didn't have 24/7 Wi-Fi. But sometimes when he's not here, I turn it off, and it's a tangible difference.
He'll be moving out soon.
I know, but I'm not looking forward to that.
Just think of the sleep you'll get.
Yeah, my kid's in college.
Okay.
He's driving around. Anyway, so one way to really improve the whole light regulation thing, as goofy as it is to get some amber-colored construction goggles.
Mm-hmm.
And you just wear them around from like 7:30, 8 o'clock on. And they'll just sort of refract the blue light out of your pupils to some degree. Obviously, when it comes to the use of smart TVs, computer screens, I don't know about most phones, but depends on the phone, I think. You can download either f.lux or something called Iris, which are the two main free, mostly free, screen dimming software, which basically, and they're both trippy. If I'm doing a lot of like actual work where I really need to interact with my screen, I use the f.lux because it just dims the blue light out.
It's on my screen, if I'm working late at night, it's like I'm looking at something through this really severe orange filter.
Yep.
It totally diminishes that. These glasses, I don't know if you can see it, if you're looking at the video here, are designed to minimize blue light. I've got yellow ones as well.
Yeah, I just noticed that when you tilted your head, I was like, oh, they're tinted. I didn't know that.
And that's on purpose.
Yeah.
Because I'm always staring at a screen or something for work, right?
Yeah, so the f.lux is going to basically dim, and I love this part of that program because I could be sitting, wherever I'm sitting in my home or at work, and the screen will just change colors over about a 3 to 5 second period. And then when I look out the window, it's dusk. And it's like every day it's slightly different. But because when you type in your postal code into the program, it just knows in terms of geography exactly when
sunrise and sunset is.
Yeah, so that's pretty cool.
Yeah, it's a very smart.
Iris is a little bit more controllable. And that one, when you turn it into like health sleep kind of like settings, the entire screen just turns red. Like it's literally like you just sit back going like, wow, that kind of gives me like it gives you like an almost kind of like low grade headache from trying to overfocus your eyes.
Oh wow.
And after about 2 minutes, your screen starts to look kind of normal because your brain has adjusted to the light of evening kind of thing. But it's a way more like kind of like in your face with that.
So we've been talking about, I guess, the light from devices, and I think it's really important to note that that's probably a real major contributing factor.
It's the most, I think, of all the things that are accelerating due to the access of screens in every room of your house at every age. It's having more impact on our behavior, our social lives, and our sleep chemistry than anything. It's kind of insane.
I've read that blue light from devices and that sort of thing over time can actually lead to macular degeneration.
I wouldn't be surprised.
Yeah, which is kind of, I've often, one of the ideas that I got in the back of my head is computerglasses.com as a side business.
There you go. What would be interesting if we had an app would be to make whatever you're watching on your computer, if it's text or something else, is if there's a way to parallax the relative distance.
Mm-hmm.
So you're reading something and then all of a sudden it's going to seem like it's closer and then farther away.
Yeah.
That would improve human eyesight, because at very little time in human evolutionary history have we looked at something this far away for at the same distance for hours and hours all day. Whereas, when you're looking from tree to rock to food to friend to, other furry dude or whatever's going on in the jungle, I mean, everything's always shifting distance, right?
The rule that I know that sometimes I subscribe to is 20-20-20. So every 20 minutes, focus your eyes for 20 seconds on something 20 feet away or more.
Perfect.
Right?
That's a great one.
And while you're at it, stand up. Right? So physically do something different with your body, which I think, for me anyways, whatever it is I'm working on, if it's just stuck in my head, it gives it a chance to actually sink further in, and like really sink into a knowing part of me, as opposed to just stuck in my head. I don't know if there's any kind of doctory thing you can talk about that. Maybe that's another podcast, but physical movement helps me learn better. If you're watching this podcast, you'll see me twitch because I'm just taking it all in, right? I'm a fidget spinner waiting to happen over here.
Most people learn better when they're laughing or moving.
Yeah, for sure. So anyways, that 20-20-20 rule
it's a good one.
is really powerful if you're stuck staring at a screen for 8 hours a day.
Yep.
Any size of screen, I should say, too.
Makes sense. So if we've got a sense of temperature, right, a couple of degrees lower, white noise for sound, adapting light in screens and stuff like that for the visual part of it. Next thing is to just recognize that, again, with respect to sleep drive and waking drive, especially if you're moving into like a sleep restricted phase, when you're super uptight about all your sleep hygiene protocols, you're only giving yourself 6 hours to actually get to sleep. The next thing is, well, if I'm going to be basically sitting around for 18 hours a day waiting between my chance to sleep and my chance to, sleep, during that 18 hours, the more you can focus on awareness, frequency practices, stress reduction practices, any kind of mindfulness thing that just makes sure that any little triggers and mishaps during the day don't build up any momentum.
So there's actual opportunity to press pause from all the momentum that's actually being built.
Yeah, so I think we talked about this a little while ago when we talked about applied meditation, but I think with meditation, especially with respect to sleep, you have like 3 options, kind of like exercise. So you could meditate in the morning and make sure that your day is like, I'm starting my day off as the Zen master. Okay, good choice. Or you come home and, have your food and clean up your house a little bit and then do your meditation so that you've cleaned off your day, so that you're like, okay, this is me, it's all good, and now I'm going to go to sleep, and hopefully the monkeys in my head aren't going to be jumping up and down because I just did my meditation.
Right.
Option number 3, and this is what I recommend people do, for a minute or two every hour or two, go into your meditation, so that throughout the day, if you're getting wound up, you can unwind yourself a little bit. 2 hours later, you're wound up, you can unwind a little bit. So as long as you have this awareness frequency where you check in enough times a day to make sure when you come home, you don't feel like you need to meditate to be you, then that worked really well.
And I would think that it sounds like just a huge stress reduction, which kind of leads us back to the beginning of the conversation around cortisol and all those other sort of things as well, too.
Yeah, and I think if I was to get really, if my sleep got really bad and I felt like, oh my God, I really need to focus on this, I would probably come up with some way of communicating with most of the people close to me in my life that, for whatever reason, I've decided to communicate very consciously, very patiently, that I am not interested in, impatient barbs and, weird, cynical things that could be taken personally and stuff like that. So, I mean, if I was really, really deep into this with respect to stress reduction, I would probably have a conversation with people that I spend most of my time with, just saying, look, for the next little while, I just need to be like super chill and make sure everyone's really clear so that I'm not lying in bed going, I wonder what they meant when they said, or,
Right. Right.
you know, that funny look across the kitchen counter when I asked for the, you know, would you please do the dishes, you know, or something. So, you know, anything we can do preventatively, proactively to keep stress from building up is going to help the sleep drive have more room to build up too. There's all kinds of different metabolic instability, not just from stress, but from caffeine, sugar, alcohol, undiagnosed food sensitivities, commensal infections that never really take people out, but do make your immune system more aggressive. I mean, we could pop open the Pandora's box of all the subtle psychological reasons why people can carry grudges or maintain a pretty self-loathing kind of stance in the world just because it's familiar, and it's kind of hard to sleep when you spend most of your time literally hitting yourself over the head with a stick of judgment and things like that. One of the weirder things I've come across researching sleep is positioning your biggest social activities away from your sleep.
Meaning, like, don't be busy with your mind later in the day, or
well, more like don't decide to have a bunch of friends over to play cards at 9 p.m. and then expect to go to sleep at 11 and actually sleep. Because primates, as very social, integration-driven kind of mammals, our social time is a time of profound, subtle connection and association and mild paranoia about what could go wrong. Or what did those two people say to each other, and what does that mean about me? And, you know, imagine you're in a relationship with somebody and you're at a dinner party, and for whatever reason they're flirting with the person at the other end of the table, and it's just they're having that kind of a day, and now you're going to go and lie in bed thinking about all the vicissitudes of fate around partners who don't notice you or don't care, or, you know, the places we can go with. I mean, of course, you could just drive home with your partner in the car and say, so looks like you and Dave are hitting it off, and then just have that conversation so you can sleep.
Dave's a nice guy.
Yeah, of course he is. Just happened to notice though. But those kind of things. I mean, I'm cherry picking a really bad example, but and they even actually in the research on sleep hygiene, if you're going to watch a show, it's better to watch like a documentary about animals than it is about something that has to do with a lot of human dynamic. Because the survival primate, Mary the monkey voice in our head, who wants to make sure we're always a cool, you know, part of the tribe, will naturally be running through their minds on a very subtle subconscious level everything that they picked up on a social cueing level that makes them emotionally more intelligent and safe. So this is literally in the literature. Wow. If you're going to watch a show, make sure it's pretty solo, not a lot of conversation, not a lot of social dynamic, because, I don't know, this is a weird image, but we probably have all seen, you know, you take your dog to the park, you play frisbee, you come home, the dog is happy, has a little snack, lies on the floor, and 15 minutes later is doing some kind of dog mamba herky jerky, you know, kung fu thing on the floor while it's sleeping. Fundamentally, on a neurological level, burning in the neural pathways of how to turn left and right better.
Right.
Because that's why its legs are kicking, is that it's remembering maybe when it got banged in the side of the face by the frisbee and was like, oh, what should I have done then, or how I would have, you know, zigged or zagged to do better. So that's what's going on for those animals, and those animals are driven obviously around kinesthetic survival much more than peer bonding, whereas primates, you know, as long as we can manipulate our peeps, we're probably going to be okay.
Right. We don't have to worry about zigzagging around a
Yeah,
dog.
well, that's a bit of a cynical way to put it, but I just think it's one of those interesting things around social connection is a hugely good thing for our species. It's just recognizing that, keeping it a couple hours away from your sleep is more effective than trying to like pack it in for that last 5 minutes and then try and sleep.
I've got a friend who's got a part of his, he doesn't use the word sleep hygiene, but his idea is devices go off at 9 o'clock, 9 p.m.
Yep.
So don't text me after 9 p.m. because I'm not going to get it at least until 8 o'clock the next morning. And he's in bed by 10:30, and he gets up at 7.
Yeah.
So his routine is devices off an hour before bed, and devices don't go on until an hour after I get up.
Yeah, I wish that I had that kind of control over my stuff. Maybe I will someday.
Yeah.
But that's definitely, I would put that on the list of sport.
That's something to ascribe to or try to attain. But I think it's for him it's really good because he's super driven, and if you present him with a problem, it's not over until it's done and fixed and posted in 15 different places and all that sort of thing, right? So for him to get that text, say at like 9:01, he wouldn't be in bed till 12:30.
Yeah. Well,
which doesn't work for him because he's so driven during the day. He needs all of the gas in the tank that he could possibly get, right?
Yeah, and I mean that's where sleep hygiene actually really, I don't know, presents itself as the word hygiene. Like that's our job.
Yeah.
So a couple other things that are kind of just broad strokes. Obviously, the more nutrient dense your diet is, the more nutrients you're getting per calorie per meal than just calories, in the sense of empty things like pasta and bread and stuff. So by having a nutrient dense diet, you're going to have all the cofactors to build the neurotransmitters to make the brain chemicals you need to have a good brain. At the same time, by changing your diet away from the sort of standard American puffed everything and, ground up grain everything and processed everything and fried everything and packaged everything.
And corn everything.
Yeah, high fructose corn syrup and other fun things you can do to damage every part of you. Obviously, by having more nutrient-dense fuel in your body, not only are you going to be able to repair any kind of damage quicker, the likelihood that your microbiome or all the happy bugs in your tummy, that it actually turns out make most of your serotonin, 60% of your melatonin, and all this other stuff. Without that engine in your GI tract building neurotransmitters for sleep, you could have the best sleep hygiene in the world. You could be trying to pay off your sleep drive, with some back sheesh, at 2 a.m. in the back alley, and it's not going to make a difference because you can't produce the right kind of neurotransmitters because your guts are all messed up.
Right.
So when it comes to the idea of supplements for sleep, I think step one is, heal your gut, heal your life. I mean, we did a whole podcast just on that, affirmation right there. Because again, that's the machinery of neurotransmitters. You kind of have to have them to see anything else go on.
Sure.
Immune regulation is a really big thing because a lot of this is due to just low-grade latent inflammation in the body, but especially in the brain. So there's like vitamin D and chaga tea and all kinds of other immune modulators that are just going to slow down the rate at which you produce inflammation, which it's not technically an anti-inflammatory, but it would be a good idea. When it comes to actually using anti-inflammatories for the brain for sleep, there's resveratrol, really unique and potent in one way. Alpha lipoic acid, unique in the sense that it can help transfer more neurotransmitter tissue across the blood-brain barrier as an anti-inflammatory, which is pretty trippy. Lots of other plant-based anti-inflammatories that are, in general, just good for people. SAMe comes to mind, specifically around neurological inflammation as well. Cannabis, obviously the CBD, the stuff that doesn't make people high, it's a great anti-inflammatory, anti-anxiety, muscle relaxant, but an immune modulator specifically in the brain, especially when it's with vitamin D and the ALA, alpha lipoic acid. So that combination is pretty cool.
And there's a podcast about that.
And there's a whole podcast about that too, yeah.
Of ours. It's almost like you're running down the list of all the different podcasts that we've done in order to fall asleep.
There you go. That would be one way to do it. Let's see. Obviously, using cannabis with respect to kind of the more indica, kush, purpley sides of what's available for either smokable or ingestible concentrates. They would be good. It either by itself or with cannabis, things like passion flower, lemon balm, and hops, all as just regular sleep aid plants. They actually have the same entourage terpenes as your indica kind of cannabis in general, allowing for deeper sleep overall with less of the hangover, because a lot of people who use THC for sleep, they just tend to overdo the drug my brain thing, and then they wake up feeling like a drug brain. So balancing that out. Depending on, I think, during the day, like what the biggest perturbations are, like if it's more depressive things, St. John's wort, more anxious things like L-theanine, GABA, just to make sure that through your day you can systemically and consistently modify your state towards restful, just a bit of self-control in that way. Because I think that's just an instinctual thing, although sure we might be walking around with a Ziploc bag full of fun, chewy tablets in our pocket during the day. At least by the end of the day, you can look back going, wow, that was a busy day, and I managed to not get completely stressed out, completely wound up, completely dejected, or disappointed in some way, just because I was taking care of myself. Anything that has to do with inducing hypnagogic states, like acupuncture, craniosacral massage, float tanks, those are, what's the statistic? 1 good hour of a float is as good as 4 hours of deep sleep.
Wow.
Right. So lots and lots of adjunctive therapies, and I'm sure I could go on for another hour about all the tricky little hacks that are out there. But the thing I think I really want to just, if I was to try and impress people with a point, is statistically sleep hygiene, proper sleep management, sleep assessment, having an ally in some kind of health field that is more about prevention and modulating an unstable metabolism instead of just bonking the symptoms. If you're trying to start somewhere, that would be a great place to start. Obviously, if subjectively you feel like sleep is just one of those things, start with that and everything else, and find someone to work with who can really be a good detective. Because if you can if you can fix the why you're not sleeping, you're going to fix the why of everything else that's going on a subtle chronic immune and epigenetic level that will eventually turn into something dangerous.
Well, it's it's just one of the foundational things to health is to sleep, right? And sleep well. So it only makes sense that taking care of that's going to take care of everything else.
Yeah, and some of us just have a block, the sleep, the little death, the loss of life, the lack of experiences and joy, and blah, blah, blah. It's like, yeah, well, maybe with some good organized sleep, you enjoy those that are 16 hours way, way more.
Yeah, sure.
And remember them way, way more, and all that.
All that for sure. I'm looking at the clock and we're at about 1:40 in here.
No.
Yeah.
No.
Yeah. So much for a concise episode on sleep here. But there was one thing that you said you might want to come back to, and I'm not sure if you want to pick this up just because of the time. Melatonin.
Oh, yeah, right. Thanks. So very quickly, it didn't feel like an hour and 40 minutes.
It's because it's a very relaxing thing to do, is to talk about sleep.
Well, I think we're also just habituated from the last epic episode. So,
and it's these blue lights that we're staring at.
Yeah, right. Okay.
I'm so awake.
I'm going to get a clock.
Okay.
Anyway, yeah. So melatonin, most melatonin you get over the counter is just pure melatonin, and it's like 3, 5, 10 milligrams. A lot of people start with 3 very quickly, end up at 5, then end up at 10. And if you were to imagine it, you're basically taking like a fist of melatonin and punching yourself right in the pineal gland, screwing with the whole interaction between the SEM, the suprachiasmatic nucleus, and those master regulating glands and everything else. Because there's no way for your body to endogenously produce that many milligrams of that kind of a neurotransmitter or hormone, depending on how you look at it, in that period of time. So inevitably you're going to build up a resistance, and downstream melatonin may or may not be able to do a lot of its other jobs.
Right.
Because, you're overdoing it a little bit. So the ideal thing with melatonin is to, one, make sure it's timed release, and two, mix it with as many plant alkaloids that are known to induce sleep drive. So again, passion flower, hops, lemon balm, oat straw. Obviously, there's a bunch of Chinese herbs if you know Chinese herbs, but I would just start speaking Chinese, so that's not going to help anybody.
Might put people to sleep.
Yeah, there you go. Ow.
It's the end of the podcast. I can make bad jokes, can I?
Yeah, pretty much. So yeah, that basically just covers it. And with respect to the kind of title, of the episode, with respect to insomnia, how we age, and obviously autoimmune disease, that's something that I really, really just want to make sure it's reiterated, that although we're speaking about the mechanics of sleep, the physiology, and some of the hacks that people get some results with nowadays, your really big reason for getting into this would be because you are dealing with an autoimmune condition.
Mm-hmm.
You are concerned about more long-term complex health outcomes and stuff like that, and are obviously aging, unfortunately, rapidly, because I can't think of anything that's going to age people rapidly than like severe debilitating insomnia.
Yeah. I feel for people who have that sort of condition. I know for myself, if I ever have a crappy sleep, what I'm like during the day, I can't imagine being like that all the time.
Yeah, it can get pretty. I don't know. I've had times in my life where it was the song the rest of my life was marching to.
Wow. Let's wrap it up there.
Okay.
Yeah. This has been episode 42 of the Fusion Health Radio podcast. This is your cue.
Oh, we're calling it Insomnia, Aging, and Autoimmune Disease.
There we go. Maybe we'll get that a little bit more practiced and polished for the next one.
I'll just put like a little sticky note to my head. Although now we're on video, people would see it, but it would make for some jokes.
We'll just put it off camera right here. People can't see my hand right there. Yeah. So this has been a podcast with myself, Anthony Sanna, in studio with Dr. Michael Smith. If you like what you heard today, you have any more questions, ideas, concerns, please do reach out. You can reach Michael and I both. Medical related questions go to him. Anything else you can ask me through our Facebook page, Fusion Health Radio. Look for us there. We're all over the internet. You can just Google us, Stitcher, Podbean, I think Intune, Mixcloud, all over the place.
Wow.
Yeah, it's and of course Apple for those if you like to get your podcasts there. One of the things that Michael and I are working on is a Patreon account. That's pretty big for us to actually be asking for money. Gulp. But that's something that we'd like to do is ask for your support because we love what we do and we think you love what we do. So help us do it that much better.
Do we have a basic sort of tier of reward things?
There's a Patreon page that exists right now, okay. Patreon.com/FusionHealthRadio. There are some tiers there. We need to work at the back end of that. But at the very least, you can take a look and you can bookmark it. And by the time you actually hear this podcast and it actually gets put out, it should all be done. And I'm going to, there's some wood. instead of knocking myself in the head. So yeah, please do share and support today with your
You have been listening to Fusion Health Radio. Please add your comments or post a question at Facebook/Fusion Health Radio.